All right, everyone, welcome. Great. So, am I echoing here? We're ready to get started here in a minute. I just wanted to first thank everybody for coming. My name is Chad, the owner of DopaFit, the Parkinson's Disease Movement Centers in both Southampton and Worcester, Massachusetts. We're really excited for this talk today. We know we've been, myself and the doctors have been getting a lot of questions, and we're eager to get the best information that we can to you about the vaccination and people with Parkinson's disease. We're going to ask if you can to hold your questions to the end. We will ask that everyone stays muted. And then at the end, or as we go along, if you'd like to throw them in the chat box, and then Dr. Hohler will take a look and answer your questions. But I suggest you wait to the end because her slides and her presentation may go over the question that you're asking. So Dr. Hohler, I'm going to turn it over to you.
Thank you so much, Chad. So happy to be with you all again today to give you some updated information about the COVID-19 vaccine. So I'll give you some general information, and then we'll also talk about COVID-19 as relates to Parkinson's disease, Parkinsonian disorders, etc. I have many questions that were sent through from Chad and from our patients otherwise. So a lot of your questions I hope will be addressed in the presentation. And if not, we will have some time at the end to go through all of the questions that you might have that I can answer, okay? A little bit more about me. My name, as we know, is Dr. Anna Hohler, and I'm the chair of neurology here at St. Elizabeth's Medical Center in Brighton, Massachusetts. We also have clinics where we see our patients in a variety of settings across Massachusetts, including Brockton, Fall River, Norwood, Waltham, Methuen, just to name a few. And so we're happy to evaluate patients with Parkinson's disease or Parkinsonian disorders, and we can do that either in person or via telehealth. We have a very robust telehealth system set up due to this current pandemic, which will likely continue in the future. And so even if patients are in Middle or Western Massachusetts, we have many patients that we follow in those areas. We are happy to collaborate with the neurologists that you have in those areas or take you on as our patients if that's what you would like. So just to leave that information for all of you. So today we're going to talk about a topic that's near and dear to all of our hearts, the COVID-19 vaccine and Parkinson's. So let's see if I can, here we go. So as you know, COVID-19 is a respiratory illness. It also affects other parts of the body as well. And so people can have difficulties in terms of their brains and their limbs and their other organs as well. So their kidneys can be affected by COVID. So it really can be a widespread process, but most commonly it infects people through the respiratory tract. Older individuals are at higher risk, and those who have underlying medical conditions may have worsened outcomes when they are infected as well. So what is COVID? COVID is a coronavirus, and it is like the common cold, a little bit like SARS and a little bit like MERS, the Middle Eastern Respiratory Syndrome. And so this COVID is a coronavirus that was first noted in China and now has involved every country in the world, some at higher rates in terms of detection. And now we are hearing about some newer mutations in the virus as well, which is very common for a virus. Viruses, part of their ethos is to mutate so that they can stay relevant and infect in a wider degree. So when we think about COVID, the typical types of symptoms that people have are things like difficulty breathing, shortness of breath. People can have fever, cough. They can also have difficulties with muscle aches, headaches. And one thing that's very characteristic of COVID is loss of smell or taste. So we don't have that in any of the other common respiratory illnesses. And so if people do have a loss of taste or smell, it is really important to get tested for COVID. So when we think about COVID-19 with Parkinson's disease, What we know is that people who have COVID, it can worsen their underlying medical issues. So what that means is if you have Parkinson's disease and you get COVID, you can have worsening of your tremor, your slowness, your stiffness, or difficulties with your walking. And so some of the patients with Parkinson's disease who develop COVID require a medication adjustment while they're fighting their COVID. So they might need to perhaps have a little.
Oh, back to you.
There we go. I'm back on. In addition, oftentimes people can have changes in terms of their blood pressure, their heart rate when they have COVID. And many of you have heard a little bit about something called long haul COVID, where people can have what we call autonomic dysfunction after their COVID, which can present with lightheadedness, sometimes near fainting or fainting. And those are all types of things that we are prepared to be able to manage. So one thing I would like to tell people is that if you do become infected with COVID-19, you want to, of course, let your primary care doctor know, but it's also important to let your neurologist know as well. They might do some more diligent monitoring and or adjustment of medications during the time that you have your infection. So some of people have asked whether or not, if you are wearing a mask and socially distancing, do you need to be vaccinated? And it's a good question. So the vaccination, what it allows you to do is to have your body fight off infection more easily. So wearing a mask and socially distancing helps to reduce your risk and reduce your risk of transmission to others, but it doesn't necessarily help you fight the disorder. And so the vaccine in combination with the masks and socially distancing is felt to be the best way where we can achieve lowest risk of infectivity and then also lowest risk of transmission. So movement disorder specialists and the Movement Disorder International Society in particular has recommended COVID-19 vaccination with the approved vaccines for all persons with Parkinson's disease, unless there's a specific contraindication. And we're going to go into those. So in general, people should get the vaccine. Right now in the US, there are 2 COVID vaccines that are currently available. Both are very effective, safe, and easy to both administer and to receive. And the idea is that they help reduce your risk for symptomatic development of COVID-19 and help you speed your recovery if you were to develop COVID-19. So you want to, if you have Parkinson's and in general, you want to discuss with your primary care physician how you are going to be able to sign up for the vaccine. And we'll talk about that a little bit. As you know, Massachusetts has some state sites that are available. And in addition, a lot of the healthcare systems also have specific injection availability. All of the injections are rolling out in a tier system based on risk. So the first round of vaccinations were for healthcare workers and those kind of emergency workers. And then now the vaccine is available for those who are 75 and over, and it's rolling out to other groups, including those with underlying medical conditions. The 2 vaccines that are available, which are Pfizer and Moderna, both require 2 injections that are several weeks apart. Moderna is typically 3 weeks, Pfizer is typically 3 weeks, Moderna is typically 4 weeks. And when you get scheduled for your first vaccine, you want to make sure that your second vaccine can happen at the same facility. And the reason why I mention that is because some of you travel and some people are in different states at different times of the year. So you want to make sure you organize yourself to be in the same location for both of those injections. And that's very important because there's continuity in terms of the injections that are being received, and the sites are dispensed amounts of vaccine based on the idea that they're going to be giving 2 of these injections. So These are the components to the 2 vaccines that are currently available. On the left, you see the Pfizer vaccine. On the right, you see the Moderna. And the reason why I show these to you is because some people have specific allergies to specific byproducts in vaccinations. And so if you were to have an allergy to something like acetic acid or something, perhaps Moderna wouldn't be the best, but you still potentially could be eligible for a Pfizer vaccine. So that's why I'm providing this to you. And these slides will be available for all of you after the presentation. Now, the people who are resistant to getting the vaccine, many have discussed with me that they're concerned that these new vaccines are going to alter their DNA. And there is no evidence that that is the case. So I just want to be very strongly say that right up front. So they do not interact with your DNA in any way. So what they do is they work with something called messenger RNA, which is mRNA. And basically that's the type of process whereby there's a triggering of your immune response. But this is all outside of your nucleus, which is the central core of your cells. And it's only if DNA is changed in the nucleus that you have a change in your DNA. So what happens with the mRNA is it's just increasing the recognition that your body has to the virus. And once it performs its functions, our cells break it down and get rid of it. So it's not permanently a part of our makeup either. And so the end product of vaccination is that our bodies have learned how to protect against future infection. And the immune response to making antibodies is geared up to be able to quickly identify COVID-19 should we get exposed and eliminate it from our system as quickly as possible. Are there other vaccines on the horizon? Yes, and some countries have their own vaccines. You may have heard about Sputnik in Russia. There's also a third vaccine that will likely be available shortly from Johnson & Johnson. It's right now before the FDA and they're trying to get emergency approval. They have a single injection rather than 2 injections. And their efficacy is about 85%, a little tiny bit lower than the Pfizer and the Moderna, but also very effective. And it is likely going to be rolling out in the next month or 2. Individuals right now are not able to choose which type of vaccine they get unless, as I said, they have an allergy to a specific component. In most cases, all cases right now, the idea is that between Pfizer and Moderna, the vaccinations are equal. And the availability of the vaccines depends on what vaccine has been shipped to the site where you're receiving the vaccine. This is a hot topic here, the contraindications for COVID. So what things should preclude me from getting the COVID vaccine? So here they are. Number 1, a severe vaccine allergy or a severe allergy to an injectable medication means that you should definitely talk to your primary care doctor. It doesn't mean that you're not a candidate, but it just means that you just have to have an extra step of evaluation before you get the vaccine. If you're pregnant or planning to become pregnant in the next 2 months, if you're breastfeeding, the next one, if you're on blood thinners or have a clotting or platelet disorder, you still may be a candidate, but you should just check with your primary care doctor. If you're immunocompromised or taking a medication to suppress your immune system, that's something that you should discuss with your primary care doctor. And then if you, for any chance, are enrolled in a COVID treatment study, or if you've been treated with monoclonal antibodies within the past 90 days. All of these require you to chat with your primary care doctor before you get a vaccine, just to make sure that you are good to go. We're going to talk a lot more about other allergies down the line, and so I'll address that in a little bit. Okay. What if you've had something like Guillain-Barré or something other type of neurologic consequence from a vaccine? In that case, you want to talk to your primary care doctor and see if you are still eligible for vaccination. What if you're allergic to bees or milk or eggs or something like that? Those are also good questions. In general, if you're not allergic to any of those components that I showed you before, you should be okay with your vaccination. Some of my patients who are very nervous, what I have them do is make sure they run it by their primary care doctor, and I have them bring their EpiPen if they have an EpiPen for their allergy along with them. That has really reduced everybody's nervousness and anxiety about whether or not they have allergies. So that's something that you definitely can do, not a problem. You also will notify the individuals at the vaccine site if you have any allergies, and they'll be very careful to monitor you in an extra diligent fashion. The COVID vaccine has a lot more monitoring than any other vaccine you've ever had in terms of shingles or flu. So there is a period of time after the vaccine where you actually sit and are monitored for 15 minutes at least to make sure you don't have any reactions. So this helps to ensure that if you were to have any difficulties, that the facility and the healthcare staff could help you if need be. How do you access the vaccine? So in the US, the vaccine has been distributed to all 50 states, and each state is working on distribution. In addition to that, now many of the healthcare systems have also contracted to receive vaccine. Now, most recently, some of the pharmacies, including CVS, will be starting to get shipments as well. So much like how people get the flu shot, that might be something where people can gain access down the line. The best thing to do is contact your primary care physician and let them know that you want the vaccine, and they will let you know where you should get it, when you're eligible to get it, etc. The other option is, if you can't get a hold of your primary, is to talk to your local health department. Now, in terms of particular access, the VA system has set up access for patients who are VA eligible. So VA personnel obviously vaccinated in the early phases, and now also veterans living in long-term care facilities, and now VA veterans who are at high risk for COVID based on the VA and CDC criteria, and who are at least 75 years old, can get the vaccine through the facilities. There's a website included at the bottom of this slide where you can go to get more information about your particular VA, or you can just go online and Google COVID vaccine and VA, and you'll get right to the appropriate sites. But that is very new, and I want to make sure everybody knows about that, because it is a great benefit that the VA is allowing people to have their vaccine through the VA. In addition, for the patients of mine who are through the Steward healthcare system and who have their primary care through the Steward healthcare system, we are also rolling out vaccination programs at a variety of sites in Massachusetts, including St. Elizabeth's, Waltham, and Brockton is now open as well. So if you have a Steward healthcare provider who's a primary care, or if you're interested in establishing with Steward for your primary care, we can also help to coordinate your vaccination through our system. What should you bring when you go to get vaccinated? You want to take your personal information, so your ID, and you also should take your medication list. If for any chance there's any difficulty in any way, it's good for the individuals, the healthcare providers at the facility, to know what medicines you take. If you're prone to fainting, and Parkinson's patients are at higher risk if they have blood pressure problems, particularly low blood pressure, you want to let the nurse know who's going to be administering your vaccine. I also recommend that you bring some extra water to drink before the vaccine and after to help stabilize your blood pressure. As I mentioned before, if you have any other allergies for which you have an EpiPen, bring your EpiPen with you. It's always better to have it available and to let them at the facility know that you have it available and where it is in case they need it. During your first vaccination, you're going to get a card that has your name on it, the date, which vaccine you received, and when your next date appointment is to get your second shot. You keep that card, and most people take a picture of that card on their phone in case you lose it, because that's going to help in terms of your vaccination records. So you're going to keep that handy. So when you're at the vaccine center, you're going to enter in, and most of you will have an appointment for a specific time to get your vaccine. You're going to fill out paperwork, including a consent form that says that you understand that this is a vaccination, that goes through the different contraindications, so reasons why you shouldn't get the vaccine. You'll sign that, and then you're going to get the vaccine like you would a flu shot. So I recommend you wear short sleeves, maybe a zip-up sweater or sweatshirt so that you can easily get your arm out. and you're going to get the shot, and it feels just like getting the flu shot, the exact same thing. Then you're going to sit under observation for 15 minutes. And usually this is kind of in an open area, and there are medical personnel watching you. If you were to have any symptoms or problems during that time, you would let the personnel know. Pain, weakness, numbness, lightheadedness, headache, anything like that. After the 15 minutes goes by, then you proceed to the checkout area, and they check again to make sure you aren't having any symptoms, and then you're free to leave. Let's talk about side effects from the vaccine. In general, side effects are minimal, particularly after the first dose. Sometimes after the second dose, people may experience pain at the injection site, fatigue, headache, muscle pain, chills, joint pain, fever, swelling in the injection site, redness, and some people may get nausea. Typically, those symptoms will resolve within 48 hours. If you were to have any significant symptoms, you could contact your primary care or, of course, go to your nearest emergency room. I have had no patients who have had severe symptoms requiring them to go to the emergency room, but it is possible that you might have some mild symptoms that may resolve with a bit of Tylenol or Advil if you are able to take those medications. Do I need to wear a mask after I get the COVID-19 vaccine? This is a great question. You do need to continue to wear your mask and continue to socially distance. Now, why is that? The issue is that this vaccination helps lower your risk of contracting the disease and then also speeds your recovery, but it doesn't reduce your risk of getting it altogether, and it doesn't reduce your risk of transmitting it. And so the idea is, once there are enough people who have been vaccinated, and the idea is that it's about 70 or 80% of the population, there will be a herd immunity that will have developed. And then at that point, likely there will be some guidance from the CDC about reducing mask wearing, etc. But for now, your COVID vaccine helps to reduce your risk, but doesn't eliminate it completely. If you had COVID-19, should you still get the vaccine? And the answer is yes. The CDC does recommend that you get the vaccine, but they recommend that you wait a few weeks, typically 2 to 3 weeks after you've recovered from COVID, to start the vaccination process. And that's just to kind of get your immune system back in a stable state before you introduce the vaccine. That way the vaccine will be its most effective. Can you still get the COVID-19 infection after you get the vaccine? Yes. So even though you've been vaccinated, you can still get an infection. But typically your symptoms will be less severe and you will likely recover more readily in most cases than you would if you didn't have the vaccine. Again, there are new, in quote unquote, mutant forms of COVID that are coming through, but the guidance is that these vaccines that we have should also be effective for those mutant variants as well. And that's this one right here. So new strains coming in, are these vaccines effective? The answer is yes. Now, does all of this information apply if I don't have idiopathic Parkinson's disease, but I have something else like PSP, MSA, LBD? The answer is yes. So the recommendation is for all patients who have Parkinson's disease or Parkinsonian syndromes to get the injection. If you are prone to fainting, you can ask to lay down for the injection as well. They have recliner beds available or chairs that you can utilize at the facilities if you are at risk for fainting. And it's better to ask ahead of time and to get into one of those recliner chairs rather than to wait till you feel faint sitting in a regular chair. In addition, as I mentioned before, you want to bring your water to drink before and after. If you wear compression stockings, you want to be wearing those on the day of your vaccine as well. And any other medicines that you take to help with your blood pressure, you want to make sure you take those on the day of that vaccine. If you have the COVID vaccine, how soon after can you get the shingles shot? So after you're vaccinated with COVID, typically we say there's about 2 or 3 weeks afterwards till you develop your full immunity. So you should wait 2 to 3 weeks after your second COVID injection shot before you start scheduling any other additional vaccines. Now, I want to go through a few other questions that I did get. One is, if I have a procedure scheduled in the next few months, should I postpone it until after I get the COVID vaccine? This is a great question. So procedures such as dental procedures or orthopedic procedures, many of which need to be done urgently, those you shouldn't wait. But usually you'll have a discussion with your dentist or surgeon or physician about procedures, and they will help you determine whether or not you should wait until you're vaccinated or do it afterwards. Some of it depends on, your risk of getting infected after the procedure. So that's something you should discuss with them. But in most cases, you don't necessarily need to postpone procedures, particularly ones that are urgent. You should continue to do those ones. Now, can I travel after I get the vaccine? So everybody, would like to go to Florida during the blizzards and things like that. So what is the recommendation that we have? So typically we want you to wait for 2 weeks after your second vaccine dose to travel so that your body develops the immunity. And then if you need to get tested, depending on what state you're going to, you want to get tested 1 to 3 days before you travel. And then you don't want to travel if you test positive. So as I said before, even after you're vaccinated, you can still get COVID. And this has been something that's been reported in the media of people who are vaccinated who then develop COVID. So if you have COVID positivity, you should not travel. When you travel, you want to wear a mask over your nose and your mouth in all public settings. So that includes planes, buses, trains. And if you're traveling in an automobile with other people who aren't in your quote unquote bubble, that would be a good idea to wear a mask as well. You want to try and stay 6 feet apart when you're traveling as much as possible. You want to make sure you're washing your hands frequently and using hand sanitizer. You also want to bring extra mask sanitizer with you in case yours becomes soiled or lost, that you have some extra ones with you. Very important is to not touch your nose, eyes, and mouth, because that's often where the infectivity enters. And a lot of times when people, if they're getting on the plane, what they do is take an antibacterial wipe and wipe down all of their tray and their armrests and everything like that to try and decrease infectivity as much as possible when you're traveling. Same thing if you're going to be renting a car, you can wipe everything down with like a Clorox wipe and things like that. And then also, if you've been exposed to COVID-19, you don't want to travel because you potentially increase your risk for transmitting COVID-19 to other individuals. Okay, now I'm going to come out of this and see if we have any questions. And Chad, do you want to?
Yes.
I can't see the chat box right now. So let
me
just.
You have to close out of the slideshow and then you'll be able to see it. Or just stop sharing screen, I guess. There we go.
All right, let me see if I can find it. Here we go. Okay, so now we'll open it up to questions. So if you want to type things in the chat box, I'm happy to go through everybody's questions. Okay, so one of the questions is, for the vaccine, does emergency approval differ from FDA approval? So FDA approval on an emergency basis basically speeds up the process whereby FDA reviews the data and then approves different types of therapies. So basically it's the same type of FDA approval, it's just that they try and expedite it. And they do this for what are considered life-saving types of therapies. So the previous Moderna and Pfizer rollouts also had expedited approval. And I expect that any other vaccines that come through will go through that, the FDA expedited process anyway. And again, the Johnson & Johnson one has not yet been approved. It's going through emergency expedited approval at this time. Okay, so another question is whether or not any of the vaccines have metal. In terms of the ingredients. So I listed the ingredients. So if you want to take a look at the ingredients on the slide, and we'll make those available for you. In general, there typically does not usually there's not a metal component in these types of vaccines, but you can review the list either by yourself or also with your PCP as well. Okay, if you need other types of injectable shots for some of your other therapies, so some people have osteoporosis, or they have lupus, or they have psoriasis, or they have arthritis, and they're on different shots. This is a great question to talk to your primary care doctor about, because in some circumstances, you don't want to vary your typical routine shots, and so you might try and schedule the COVID vaccine around that. So that's an important thing to discuss with your primary. All right, and then another question was, if you have a shot of a steroid, for example, in your back, how long should you wait to get a COVID vaccine? Typically, you want to wait a few weeks after that. Typically, what we recommend would be about 2 to 3 weeks after any back or other steroid injection, just so, again, you're at stable immune level. Typically, the back injections, the steroid is a bit more localized, so it's not a systemic steroid, so it doesn't affect your immune system as much. But just to be safe, waiting 2 weeks is probably going to be helpful for you. And then any other vaccines before the COVID vaccine. So you should wait 2 to 3 weeks between vaccines. So in other words, if you are getting the flu shot, wait 3 weeks, then get the COVID, wait 3 weeks, then get the shingle, or whatever order you'd like to do that in. So you don't want to have all the vaccines at the same time. Let's see. This is another question about a different cough vaccine, a whooping cough vaccine. So a lot of you are interested in getting the vaccine because we're hoping to be able to see family and maybe reduce our risk of getting COVID-19 infection and or transmitting it to others. And so what I would recommend is that you talk to your primary care doctor about the timing in terms of other type of respiratory vaccines. But in general, the same rule is going to apply, 2 to 3 weeks difference between the vaccines. So in terms of masks, the question is whether or not they protect you from getting infected. They reduce your risk, but they don't completely eliminate your risk of getting infected. So they don't completely eliminate your risk, but they reduce it. So that's why we advocate for mask use. Another question is it okay to take a pain reliever before or after vaccination? And in general, it is, as long as you don't have some contraindication. So if you have an allergy to over-the-counter NSAIDs, you have a bleeding disorder, or for some reason your primary care doctor has told you not to take an NSAID, like an ibuprofen, an aspirin, or a Tylenol. Other than that, in general, if you wanted to take a little pain reliever before you get the vaccination, there's no clear guidance that that's contraindicated. How soon will the vaccine be in the pharmacy? It's a great question. A lot of it actually depends on the location in the country and then also which pharmacies are available. So there's just been a little bit of initial discussion about this at the national level to allow the pharmacies to have the vaccine, but it hasn't been officially rolled out in a systematic way, and it hasn't been marketed by the pharmacies. I suspect within the next month or two, it will likely be available in the CVS or Walgreens, depending on what the contracting looks like. Okay, so what happens if you have a first vaccine and then for some reason you aren't able to get your second vaccine, either because of some other extenuating circumstance? It's a great question. The studies that were done showed that the best efficacy is to do it in this way. At this point, we don't have any clear guidance about whether or not you need to start all over again if you miss your window. But in general, typically, if you can try and get your second shot within, I would say, 3 to 5 days of your of the designated second shot time, that would be ideal. If it's going to be more than that, you also want to contact the facility where you're having it done to see if any arrangements can be made. So a question about if you're on a blood thinner and the vaccine. So this is something that you want to talk to your primary care doctor about. Depending on the blood thinner that you're on, some may be staying in the system longer than others. And so it may be that you have to stop it ahead of time. Some you don't have to stop ahead of time. And so you just need to talk with your primary care doctor about a specific blood thinner that you may be on. Okay, another question is about whether or not people who are on Parkinson's disease medications, is there any impact from the vaccination? So there have been patients who have had Parkinson's who have had the vaccine now, and we haven't seen any complication in terms of the medications that they're taking and getting the vaccine. There's a question about whether or not being on Parkinson's medication may actually reduce your risk for COVID or increase your risk of complications. So right now, you don't need to stop any of your Parkinson's medications before you get the vaccine. And the Parkinson's medicines don't interact with the vaccine in any way. Another question about, is it really important to wait a few weeks after the second vaccine before I travel? So the guidance is from the CDC, because I took all that information right from the website, is that in order to confer the immunity of the second vaccine, they think that it takes a few weeks after the second vaccine for your immune system to be fully revved up. So if you are to travel before that, you are likely not completely vaccinated in terms of the full effects of the vaccine. And it would be like you were traveling before you had the vaccine. So it just is kind of a risk, a little bit riskier to travel before the 2 weeks. If you have to, for some reason, you know, somebody's delivering or whatever the case may be, we completely understand. But if you can wait for a few weeks after your second vaccine, that's what's recommended by the CDC. If you have any more questions, please feel free to put them through the chat. Okay, question about longer for the second. Okay, so there's a question about whether or not if you wait longer than the anticipated time for the second vaccine, is it harmful to you? It's a great question. Usually waiting longer isn't harmful to you, but it just doesn't help you to develop the immune properties as quickly. So again, I think the idea is the reason why there's kind of this timing aspect is because that was based on the research, the ideal time for the first time between the two, and then the 2 weeks after in terms of conferring the immunity. So if you get vaccinated and then get tested for COVID-19, you should not test positive for COVID-19. So the vaccine, the testing shows that you have COVID-19. The vaccine helps your body to develop immunity to fight the vaccine. So after you get the vaccine, you should not test positive for COVID-19 unless you have COVID-19. Does that make sense? So another question was, is acetic acid aspirin? So salicylic acid combines with acetic acid to help make aspirin. So it's a component of aspirin, but it's not aspirin pure and simple. And that was a question. People are more likely to, okay, so did I say that people are more likely to have side effects from the second vaccine? In general, the second dose is associated with a little bit higher risk of side effects if people are going to get them. So yes, that's what I said. This, even if you do the first injection and don't have any problems, you might still have some soreness of your arm after the second injection. Okay, question about how Parkinson's patients may interact with vaccines over time. It's a great question. At this time, there is no official, what we call Parkinson's disease registry that is available that tracks Parkinson's disease patients in general. This is something that we're actually working with CHAD and the Michael J. Fox Foundation to try and help to facilitate in our state of Massachusetts. So what we're doing is working with the state legislature to try and enact a bill that will enable us to if people are interested, have their Parkinson's data de-identified, so not personal information like name, date of birth, location, things like that, but just general information about Parkinson's. How long have you had it? What side was affected? What symptoms that you have? To be able to try and study a good cohort of Parkinson's patients over time, to be able to understand things like effects of medication, effects of vaccination, et cetera. And so right now there is not any database where we can track Parkinson's patients' reactions to vaccines, but it is something that is a great idea and is potentially possible down the line should we get a bill passed where we have a Parkinson's de-identified database. Okay, question, allergy to aspirin prevents you from having Moderna? No allergy to aspirin prevents you from having Moderna. If you have any questions about that, you can ask your primary care doctor, but right now that is not a contraindication to having a Moderna vaccine. Are there false negative results from COVID tests? So there can be false negative results from COVID tests, particularly depending on the type of testing you do. So the testing for COVID, it turns out that the type of testing called PCR, polymerase chain reaction, is the most sensitive for picking up COVID. So that has the most likelihood of detecting whether or not you actually really have COVID. Some COVID tests have lower rates of sensitivity, so they may produce false negatives, but they are still felt to have enough sensitivity to be approved by the FDA and felt to be valid. So if you're concerned about a COVID test, you can ask for a COVID PCR test. Okay, question about if you're involved in a clinical trial for Parkinson's disease for a medication, should you wait until it's over before you get vaccinated? Super good question. What you should do is you should talk to your study group where you're involved and just ask them whether or not there's any contraindication. In general, none of the studies that we're involved in at our institution are saying that patients should not have their vaccine during the trial period. So in general, you will likely be able to go ahead with your vaccination, no problem. But check with your study site. How long is the vaccine good for? It's a great question. So there have been some studies looking at how long immunity will last with the COVID vaccine, and it's likely that it's going to last somewhere around a year. And it's likely that what's going to happen is that the COVID vaccine is going to become like a flu vaccine potentially, where they study the virus, they make modifications year to year depending on what they expect the virus is going to look like that year. And then it's possible that we will be getting yearly COVID vaccines. That's the idea. Right now, it's still so early. It's hard to say definitively, but the idea is that there is going to be a period of time where we're going to have most of the immunity that will develop from the vaccine, and that may wane over time. So that's still being looked into. It's possible that you may need to get vaccinated again. Is history of cancer a comorbidity? Great question. So people who have cancer currently and who are on immunosuppressive agents, they definitely should talk to their doctors about getting the vaccine. If you've had cancer in the past and are cancer-free now, that doesn't necessarily increase your risk one way or another of complications from the vaccine, et cetera. But that's something that you should talk to your PCP about. Any other questions? These are wonderful questions that you all have. Okay, so one of the things that I was mentioning early on are the contraindications. So right now, a contraindication to getting the vaccine is pregnancy. Breastfeeding is another contraindication. And then you should talk to your primary care doctor if you've ever had specific vaccine-related reactions. So like Guillain-Barré, for example. And then some people who are on blood thinners are contraindicated, and that's something to talk to your primary care doctor about as well. Okay, a question about herd immunity. So the idea with herd immunity is After a period of time, there are so many people that have some sort of immunity in their system from the vaccine or having had COVID itself, that and when COVID comes through, there are fewer people who are going to be infected. And so the rates of mortality are less, et cetera. And so the way we combat new dangerous viruses and other pathogens is by vaccinating and developing kind of this herd immunity that makes it so that not so many people will get infected at once. And that allows us to have all the healthcare resources that we need in terms of ICU beds, ventilators, et cetera, to be able to manage people even if they have severe forms of COVID. So the idea is if everybody's sick at once, then the mortality rate increases because we aren't able to optimize every individual's care. If people get sick at a lower rate and even less severely, then we're able to better manage people, help them recover. And that's the key. And so another question is, are there conditions whereby somebody under 75 can get vaccinated? So there are some conditions. So one of those is for people who are on dialysis. So right now, people who are under 75 who are on dialysis have significant risk if they are to develop COVID. And so right now, those individuals are being allowed to get vaccinated. Again, the best thing to do is to talk to your primary care doctor if you have any medical conditions, to discuss with them which tier you're going to fall into. If you're under 75 in particular, when would you be eligible to get the vaccination? It's different for every person. So COVID, Parkinson's disease is one thing that puts you at higher risk if you were to develop COVID, but there are other things. So if you also have diabetes and are on dialysis or have severe cardiac disease, for example, those things increase your risk for complications after COVID. So it might make you more eligible for earlier vaccination. So as somebody was kind of summarizing, so it is possible that we would be vaccinated regularly for COVID over time. It's possible. And again, it may be that the COVID vaccine lasts a bit longer than the flu vaccine, which is yearly, but we don't know at this point. It's still a bit early to tell. Another question is, why do we have to take this shot 2 times instead of 1 time like the flu vaccine? It's a great question. So some of it has to do with the efficacy against the virus. So the flu vaccine, the efficacy is sometimes 30 to 50% against the virus, whereas the COVID vaccine right now is above 80% in the 90 range. So that means your likelihood of getting COVID after vaccination is lower than your likelihood of getting the flu after your flu shot. And so by giving you the 2 shots, it boosts up the effectiveness to the much higher rate. If you just got 1 shot, it would probably more be about the 50% rate of efficacy. And so the idea is, because COVID is more deadly than, for example, the flu, the idea with the pharmaceutical companies is to try and give you as much of a leg up in terms of the efficacy against the COVID vaccine as possible. Another question about side effects from the second vaccine. Most people just have, if anything, a little bit of soreness in the arm after the second vaccine. Some people get a little bit of fever, a little bit of fatigue, a little bit of achy muscles. Another question is whether or not the second dose is more effective if you give it earlier. So why do we wait 3 or 4 weeks? So they have done in the studies, all of the different times trials, determining when it is most effective to give the second dose. And the reason why they determined it's either 3 for Pfizer or 4 for Moderna is because the body has to develop the immunity. And so what they found was that the first shot confers a certain amount of immunity, and that is kind of at its optimum after these 3 or 4 weeks. And then you put the second one on top of that for the secondary lift and the efficacy of the vaccine. Why does the US have such high mortality? It's a great question. So some of it has to do with reporting. So the US, everybody's trying to be very diligent about diagnosis of COVID and then also monitoring of treatment and mortality. In other countries, the surveillance is not quite as good. So the rates of reporting of COVID-19 may not be as accurate, number one. And number two, the rates of reporting of mortality related to COVID might also not be accurate. So for example, if you were to develop COVID and had a heart attack or a stroke related to that, in our country here, that would be signed off as COVID caused it, and then these other complications happened from COVID. In other countries, it might be signed off like on a death certificate as heart attack or stroke was the cause of death. And so as a result, we feel in the US that our data is very accurate. And so that may also introduce some type of discrepancy in terms of the national or the universal global reporting. Europe is reporting similarly to we are, but other countries aren't necessarily doing that. So that is one of the issues. The other issue is that in some countries there is, healthcare is more easily accessible to all. In our country, that's not always the case, depending on where you are in the country. We're very fortunate in Massachusetts in terms of our healthcare programs and our access, but in some parts of the country, the resources and the access to healthcare are not as high, and that impacts our mortality as well. Are there more vaccines in the pipeline? There are. So AstraZeneca is another pharmaceutical company that has a vaccine in the pipeline, and there likely are one or two others. What will probably happen over time is that there are going to be different types of opportunities to utilize the different types of vaccines, and there'll be further studies that look at the efficacy of the vaccines and then also the number of vaccine doses that people need to have and the frequency to determine over time which is going to be the best option for most individuals. So we're learning more and more every day.
All right, Dr. Hohler, I think that was good, and you answered a lot of questions, and a lot of very good questions came in. So I was really excited to see that. Second here. So I think with that, everyone, we'll finish up. If there were any questions that you really felt that you needed to be answered, feel free to email me, and I can reach out to Dr. Hohler and see if we can get that answered. But I feel there was just a ton of information there, which was really, really great. And and Dr. correct me if I'm wrong, but the understanding I got is unless, some of the things that you listed or that, the person's primary care says not to get it, that it's important for people with Parkinson's disease to get the vaccine.
Yes, I think that's the most important thing, is that if possible, you should get the vaccine.
Awesome. All right, Dr. Hohler, once again, thank you so much for an amazing job. We're so grateful to have you and to have you share this information with us.
It was good to see all of you. You take care now.
Thank you, Dr. Hohler.
You're welcome. Bye-bye.
Thank you.
Thank you, Chad.
Bye-bye.
Thank you.
Thank you.
Thank you, Dr. Hohler.
You're welcome.
Thanks, Chad.
Welcome.